As an anesthesiologist, especially one that specializes in trauma anesthesiology, here are 5 things that you need to be aware of that I would never do myself after seeing the injuries that I've seen over the course of my career. This involves kids usually or adults, but as parents or somebody watching this video, if you're concerned, pay attention to these 5. Make sure your kids, anybody you love, doesn't do any of them. I've seen quite a few injuries in my time as a trauma anesthesiologist. Obviously, I deal with trauma. Trauma means traumatic injuries that can be to any part of your body, to your head, to your toes, to your legs, to your nose, any part of your body. But more importantly, I've seen certain trends, certain injuries that reoccur over and over again because of lack of information. So here are 5 different activities I would never allow my kids to do and I wouldn't do myself. Now, number 5, probably the most important one that you need to know about, especially with the snow season coming or in the summer, I would avoid riding snowmobiles and 4-wheelers. Why is that? I've seen a myriad of injuries, especially kids, young kids, 12, 13, 14, 16, 20, 22, where they were involved in a rollover incident. Now, for those who don't know, when you're riding a 4-wheeler or a snowmobile and you hit some sort of rock or a bump and you go airborne and fall, if the 4-wheeler rolls on top of you, that comes with a force of almost 3 to 4 tons of machinery landing on top of your body and squishing it. Typically, this causes a spinal fracture. If it's in your neck, it can be certainly devastating, but most commonly you see it in the back. And you also have broken bones, broken limbs, arms, legs, back. And those type of injuries take such a long time to heal. Wearing a helmet is not going to prevent these type of injuries. Now, the 4-wheelers and snowmobiles are very fun. I've ridden a couple of them back when I was younger, but after becoming a doctor and seeing these injuries over and over again, especially in young people or in their early 20s, when they get these type of crush injuries, it's devastating. It's a very long road to recovery. It can take over a year if you're able to get all your joints back to moving, if you're able to walk again. So as a parent and as a physician, I urge you, don't let your kids ride 4-wheelers or snowmobiles. Or as an adult, I also urge you, these are very dangerous activities that should be left for the professionals. The thrill of the fun, it's probably not worth it. Number 4, this is an activity you should keep in mind when the summertime rolls around. When it comes to swimming pools, please tell your children, tell your friends, tell your adults, don't dive headfirst into any swimming pool, any pond, any body of water, anywhere. Why is this? It's because as a trauma anesthesiologist, especially in areas where people like to boat and have a lot of lakes or oceans or rocks or beaches, a lot of folks like to dive headfirst into water. I've seen some of the most devastating injuries from these type of experiences. I'm being totally honest, completely transparent here. The injury suffered from diving headfirst is a break in your neck, typically causing you to become a quadriplegic. What does a quadriplegic involve? It means you can't move your arms and legs. You can just shrug your shoulders, maybe lift your arms up a little bit, but the quality of life is over. There's no real recovering from a quadriplegic injury. It's a lifetime of being on ventilators. It's a lifetime of having tube feeds, a lifetime of having therapy, having people come to your house, change your diapers. It's not worth it. I'm telling you honestly, please, if you get anything from this video, don't dive headfirst into anything, any body of water. Always dive with your butt first, because if something breaks down there, it's only your legs, it's not your arms. You still have some quality of life. I wouldn't recommend diving into anything, but if you're gonna dive into anything, always go feet first, especially into a pool, because you never know if you slip and you crack your neck on the side of the pool or the bottom of the pool. It's devastating, it's life altering, it's not worth it. Number 3, this has to do with boating in general. If you're going out boating, please be aware of propeller injuries. What are these? This is when you jump off a boat which has a propeller. The propeller hits your body and it causes what they call a Swiss cheesing of your muscles. So I've seen injuries where the propeller 1, 2, 3 times on someone's arm or someone's leg and it Swiss cheesed their entire arm. You could see all the way down to the bone. These injuries are devastating. They're a nidus for infection. More than likely your limbs will end up being amputated. So if you're gonna go boating, please be careful. Make sure your captain's aware when people are in the water not to turn the boat on. And if you're a parent, I would educate your kids on this. You really want them to be aware that there are possibilities of devastating injuries that can come from a weekend of having fun with your friends. Number 2, this is very important for everybody out there because of the current uptick of fentanyl in today's day and age. If you're using recreational drugs, recreational medications off the street, you have to understand that a lot of the medications now, especially the uppers, are laced with what they call as fentanyl. That's because fentanyl causes a addiction type of quality. You get that euphoria high, but you want to get more. Your opioid receptors in your body fiend for this type of medication. So once they get a taste of it once or twice, they're going to be on it all the time. You see stories online, on TV all the time of individuals being hooked on opioids. Well, fentanyl is 100 times stronger than morphine. So what I'm telling you is be careful, please be careful. These medications are now being laced with it because once you get a little fentanyl in your system, especially if you don't know it's fentanyl, you're going to want to go back to that same illicit medication. This means that the drug dealers and the people that are making the drugs, they're aware of this. This is kind of a hook. It's kind of like nicotine, but for hard drugs. So if you can, obviously don't do drugs. If you're going to do it, please be aware of these risks, that if you take too much fentanyl, it causes respiratory depression. So it causes you to stop breathing, and it's not a voluntary thing. We give fentanyl every single day in the operating room. And I tell you, honestly speaking, we give micrograms, mcg, not milligrams, micrograms. That's because that's how strong the medication is. It's an excellent painkiller, but it also has negative properties. It causes addiction, it causes difficulty breathing, causes stiff chest, it causes nausea and other things like that. But the most important one, like I talked about, stopping breathing. If you stop breathing, nobody's around to give you any Narcan. You have maybe 6-ish minutes before you have permanent brain damage. Do your best. Please don't do any of those type of hard drugs. And if you do, I don't really have advice. Just don't do it. And number one, this is the activity I would tell everybody who's watching this video. Do not ride motorcycles. Motorcycles in the trauma field, in the trauma hospitals, are known as donor cycles. Why is that? It's because when you get in an accident in a motorcycle, more than likely you're going to be an organ donor. Because more than likely you're young and healthy, you were involved in some sort of accident, and motorcycle is just, if you get in an accident on a motorcycle, it's probably the end of your life. Wearing a helmet does help, but it's not going to prevent serious brain injury. It's not going to prevent serious bodily injury. It's not going to prevent you getting run over by a car. Never been on a motorcycle. I think they're very interesting. They're cool to watch on TV. But after seeing the injuries that I've seen, the amount of individuals that are young and healthy that ended up getting hit by a motorcycle or hit on a motorcycle, ended up breaking their legs, ended up breaking their bodies, ended up breaking their brains, and ended up being brain dead and then becoming organ donors. They call them donor cycles for a reason. There's some other common injuries I see all the time. Fireworks, please, if you are a parent, if it's close to July 4th, just remember fireworks, holding any fireworks in your hand. I've seen probably 6 to 10 injuries where the firework exploded in the hand and the fingers got obliterated. Ended up needing an amputation. It's terrible because usually it's young kids or younger adults who didn't know what the firecracker, I think they call it. I don't know the street name for it, but the one that causes a big boom, that one I wouldn't do. I would leave the fireworks to the professional. Bow and arrows, I've seen crazy bow and arrow injuries. I laugh because it's like something out of a movie. I've seen patients who've been hit with an arrow through their maxilla, through their maxillary sinus, through their head, out of the back. They survived because it missed all the major arteries and brainstem in the back of your neck. But I mean, they had an arrow in their head. I've also seen arrows in the arm, lodged in the feet. So hunting arrows are very sharp. Obviously, they take down deer. But hunting accidents, very common, more common than you think. So follow all the safety precautions for hunting accidents, or for hunting in general. And last but not least, obviously, this one is not really related to trauma anesthesiology, but I see a lot of patients that come in with concussion issues, concussion injuries. Typically, I see them in the sense that they're involved in traumatic accidents, but I also see and hear of a lot of kids who suffer concussion injuries from just playing football, soccer, playing rough with their friends. I think today's day and age, 2023, it's something to be aware of. It was big in the news a few years ago. It's kind of died down, but concussions are real. They have impacts on people's lives. They change the way you think. Your brain is just a muscle. If it gets injured enough, it's not going to recover the same way. It's the same with any other part of your body. So just be aware of that. Especially going forward, especially with your kids. Try to be aware, cognizant that, let them live their lives, but one too many hits to the head can be devastating long-term for your kids. So that was my top 5 with a couple other caveats put in. Thank you guys for tuning in. Please leave a comment. Tell me if you agree, disagree, if you've seen any of these injuries yourself. Love you guys. We'll see you on the next one.